This chapter is going to cover development. We've already talked about growth. Now we're going to talk about development. Kind of a dry chapter. The way that you will get developmental questions, they may ask, a baby comes into your office and can do the following things. What age is the child? Another way that you might get a developmental question is inside the question itself. So they might ask something, a baby comes into your office and has the following findings at 9 months of age, and you have to determine that this is not normal, that this is delayed. Another way that you might get a question is, for example, child abuse. Baby is brought into the emergency department and is 2 months old, and now has a depressed skull fracture. The parents state that the baby rolled off the couch onto a carpeted floor, and here's the baby. Well, there's several things there that just don't make sense. Number one, you don't fall off a couch onto a carpeted floor and get a depressed skull fracture. And number two, babies at 2 months of age aren't rolling over. So you need to know that developmental point to make you suspicious for something else going on. There are various forms of development, such as visual motor and language, also motor, social development, and adaptive development. You probably will not get asked particulars about that, but we will go over some of the milestones so that you'll know at what age certain babies can do certain things. So it's important to know that milestones are acquired in a sequence. You don't go forwards and backwards. It's a continuum, it's a spectrum of acquisition of function, and so you will start at one point and end up at another point, and usually in the same sequence. Maybe not necessarily every baby rolls over at 4 months of age, but certainly once they start rolling over one way, the next thing they're going to do is roll over the other way. We use this to compare normal versus abnormal by taking a large population and seeing what they do at certain ages and find out what that spectrum of normal is. Remember that an abnormality in one area, there's an increased likelihood for an abnormality in a second area of developmental delay, and so you should be looking a little harder. If you see one, look for another one. When you're seeing developmental delays, you're actually just making a description. You're not actually making a diagnosis or finding the cause. You're making an observation, and then you need to find the cause. A major developmental disorder is going to be mental retardation. This is going to be made on an actual IQ testing plus a limitation in certain adaptive areas. There are also communication disorders. There are learning disabilities, such as a patient may just not be good in doing math or may not be good at doing reading analysis, just weak in one subject. That doesn't necessarily mean mental retardation, but it is a learning disability. Other areas of development include cerebral palsy, and certainly we're going to discuss attention deficit hyperactivity disorder with the behavioral and psychological disorders, and we'll also talk about autism spectrum disorders. As anything in medicine, a thorough history and physical is important. As you guys go on in your medical career, you'll realize that about 90% of the diagnosis, 90% of the time the diagnosis will be made with a good history and physical. All the other tests that we order kind of help us out and are ancillary, but it's a very good history and physical. So you have to do a thorough neurologic exam. Why is this child not rolling over? Is it something physical? What's going on? Also developmental history, so you can see if the child hit milestones at the right age, or you can see that there's a pattern of delays ongoing that just hadn't been picked up before. And also you should always get a good family history for any other diseases or histories of developmental delays. Developmental testing is done, and one of the things that can be done is the Denver Developmental Assessment. I'll show you a picture in a second of the actual sheet that we use. Remember that normal is a spectrum. Babies don't just all of a sudden wake up at 4 months of age and after breakfast decide to roll over. Some babies roll over sooner than others. So there is a grace period, and you're going to look at that on the Denver. A failure on the Denver is 2 or more delays on the chart. You don't have to memorize the whole Denver, but we are going to go over some of the common things that are seen in the Denver. This is the Denver Developmental Scale. And the way you read it is you draw a line down at the baby's age and it intersects the various components of it, and you look to see if the baby does it or if the mom can report that the baby is doing certain things It is a spectrum. That's why there's blue and white boxes. And some babies, for example, might fall in the 25th percentile, 50th, or 75th percentile as to whether they're doing something or not. Failure is 2 or more items that the baby does not do.